Cynthia Thompson. I want to ask you all a question out there. When you go to see your doctor, do you just sit there and say everything's fine? Or if he asks you a question about what medication you're taking, do you say, I don't know? Well, my guests today are going to help us with answers to what you should do when you go to the doctor, among some other things, whenever you have a medical issue too. And I want to thank both of you ladies for joining me today. But before we start talking about all these questions I have for you, why did you all start doing this?
My son was ill for 28 years.
Wow.
It was 20. He was actually 25 years. It's been 28 years ago, but he was sick for 25 years. And it became very clear that I needed to be his advocate and aware of what was going on and understand what was happening. And I felt that he got better care because I was on top of it. And so in that process, I learned how to navigate the hospital, knew what questions to ask when I went to a doctor's visit, and really how to help him get a higher quality of care.
And so why did you decide to become a part of
Well,
this?
Randy brings the family perspective, and I bring the medical perspective. I'm a nurse. When I first started nursing, I worked in a big New York City hospital where there are a lot of indigent patients, and I realized very early on in my nursing career, which was over 40 years ago, that these patients had no voice. They had nobody to speak for them. They didn't speak the language. They didn't know the terminology. And I decided then that I was going to go to graduate school and become a nursing instructor so I could teach nurses how to advocate for their patients.
Very good.
So when Randy and I met, we realized, you know, at a personal level that we shared the same heart. But then when we really get to know each other, we realized that we both shared a passion for patient advocacy, and that brought us where we are today.
I'm so glad you're here so you can educate my viewers on the things that they should do. My very first question for you ladies, when a person goes to the doctor, what should they do? Should they prepare a list of things to ask, medications? What all should a person do when they go visit their doctor?
They need to start by taking all the all the medicines that they're taking and have a list of them. Have a list of all their allergies and a list of all their symptoms and any questions that they might have.
So they should sit down and write these questions out?
Absolutely.
Right.
And why is that a good idea?
Well, you know, is it okay?
Yeah.
You know, patients go to the doctor. The doctor, sometimes if they're lucky enough, they have a doctor who will spend 20, 30 minutes with them, but not every doctor is in a practice that does that. So the doctor comes in, does his thing, and then leaves. And if you don't have the questions written out, invariably you forget what it is you want to ask him, especially if you're in one of those little gowns that don't cover anything. The literature says that you retain 30% less when you're undressed, which means that if you don't have it written down, you're not going to remember to ask them. And in conjunction with what Randy said, you know, the medications, very often we just tell people, just put all your medications that you're taking in a paper bag and bring it to the doctor with you, including any over-the-counter non-prescription medications, supplements, because we are a medication-driven society. And people don't stop and think, if I take vitamin C, is that going to interact with my cardiac medication? If I take vitamin D, is that going to interact with the calcium I'm taking? If I take heart medication, is my kidney medication going to interact with that? So it's really important. And we're really lucky in Charlotte because we only have 2 big hospital systems and everything's computerized. So you can really go from doctor to doctor within the CMS, Charlotte-Mecklenburg Carolinas healthcare system or Presby, and all of your information is computerized now. So the urgency is not there, but not everybody uses doctors that are affiliated with the hospitals like that. So it's really important. And keeping a health history is really important for yourself. We actually have a website, and we have one online that people can use, print it up. They can fill out one for each one of their family members and email it to doctors or email it to a healthcare facility if you have a parent in Florida or out of town. But you know, that's really important. And it's not just you know, what drugs you're on and what are your allergies, but what's your past medical history? What's your family history? Is there genetics? You know, do you have a family history where 8 of your 20 family members have had cancer, which puts you at a high risk? You know, did your mother have breast cancer, which if you're a female sibling or child, that increases your risk. So it's important to have all that information every time you go to, especially a new doctor.
So what is this website you mentioned that a person could get this form from?
We have a website that we created called patientaction.com, and it is a website that has all kinds of articles that we wrote on advocacy issues and teaching you the questions to ask, who to ask them to, how do you prepare for a doctor visit, how do you switch doctors, you know, how do you select a doctor? You know, what should you bring with you when you go to the hospital? If you're a patient in the emergency room, how do you navigate through what's going on in the emergency room? If your loved one's in the intensive care unit, you know, we explain what goes on in the intensive care unit because it's a lot different than what goes on the general floor of the hospital.
And the other thing is, you know, having all the information with you is important because when you walk into a medical situation, there's a great deal of anxiety. And so you really do lose concentration because you're not used to it. You're not used to the situation that you're in and the anxiety that it causes, and your memory isn't as good, and so you might forget something that's very important.
The other thing when you go to the doctor, and I just had an experience with my husband that people don't know, but people should learn to ask their doctors when they're prescribing medication if there's a generic brand. Because my husband was prescribed, he has a disc problem in his back with an inflamed nerve, and the orthopedist prescribed Celebrex, which is hundreds of dollars a month. And I said to him, isn't there a generic? The generic was like, we have health insurance, so it was like $5 a month for the month's supply versus hundreds of dollars. So healthcare consumers, you know, our passion is, it's not that people are stupid, but people are ignorant, and they don't even know the questions to ask. It was like would be me if I went to an auto mechanic. I wouldn't even know the questions to ask. So it's about empowering people, and we use that word a lot today. You hear it on the news all the time in magazines, but you know, people say, well, what does that mean? I said, it's giving you power. And the mantra of our website is, you have a voice, use it. And we also realize that sometimes people can't use their voice, and there are a number of reasons why people can't use their voice, you know, because they're frightened, they're anxious, they're in pain, they're on, you know, mind-altering drugs, whether they've been prescribed by a doctor or they're street drugs. They're in a coma, they're unconscious, they're confused, they don't speak the language, they have a tube down their throat because they're on a ventilator and they can't speak. So these people need somebody to speak for them, and our goal is to teach either the patient or the person advocating for them, empowering them, making sure that their voice is heard, making sure that their rights are being met, making sure that they're being supported in decision making. And that's what we do, and that's what our passion is. And we'll talk to anybody who wants to hear us talk.
So if by chance I switch doctors, what are some things that I need to do when I go to a new doctor?
Well, be very clear about why you're leaving one doctor for another.
Should I tell the new doctor that?
Well, yeah, it doesn't hurt. Most of them are interested, and because when you go from one doctor to the next, they do want to hear what needs weren't met before. You should be sure and have all of your medical records with you, and having all of your medical records means not just getting reports. For example, if you have a CAT scan or an MRI, not just getting the written report, but actually getting a copy of the MRI or the CAT scan.
So I can just ask for that and I can get it?
You can ask for it at any place. They may charge you, but it's worth having if you're going to a new doctor and they can't get to the actual report. So if you're changing, say, for example, within the Carolinas medical system from one doctor to the next, they can see the actual reports. But if you're going to a new system, then you need to have all of that information with you. So a good health history, all of your medications, and all of your reports is what you need. And it.
I wanted to add when you were done. Go ahead. This is like mutton, Jeff. You know, when people switch doctors. First of all, insurance companies will pay to have people get second opinions. So if it's because of a diagnosis or a treatment plan that you're not happy with, Blue Cross Blue Shield, Medicare, United, all the big companies, they will pay for a second opinion. And very often when I hear patients say, I've been using this doctor for years and I just don't feel like he cares about me anymore, and I say to them, okay, well, let's just step back a minute and reflect, because is it that the doctor doesn't care about you, or have you created a situation where the doctor doesn't care about you? Are you a good patient? Do you make a fuss and curse at the staff? Do you come late for appointments? Do you not call when you're going to miss an appointment? Do you not pay your bills? Are you unpleasant? Are you demanding? Do you have a chip on your shoulder? Because sometimes most doctors and nurses, Randy says this all the time, their heart is in the right place. They have a passion for taking care of patients. It's a certain kind of person that goes into nursing and medicine. And so sometimes I tell people, just reflect for a minute. Is it you or is it really the doctor? What's changed?
A lot of times it's the patient, huh?
Yeah. I think the other thing that frequently isn't realized is that sometimes you need doctors for different reasons. So sometimes you need your primary care physician to be loving and kind and available. And sometimes when you get into something more complex, you need somebody's brain. And not everybody that has an extraordinary brain is as warm and fuzzy. But sometimes you have to decide that you need the brain.
Yes.
And then you need to go to your primary care physician for the warm and fuzzies.
Let's take a short break. And when we come back, I want to talk about patient rights and what exactly does that mean, okay?
So, do you have any questions?
What is your soup of the day?
Oh, how's that cooked?
Is it grilled? Can I have it steamed?
So, what do you recommend?
Any questions?
For the 10 questions everyone should know, go to ahrq.gov.
Hey, Luis, did you know that you're Elmo's plan?
Your plan?
Yeah, Elmo's mommy said that if Elmo is too sick to go to school, the plan is that Elmo stays with Luis and Maria.
Oh, yes, we have that plan all in place.
Great!
You never know when your child will be too sick to go to school. So have a plan ready so your child can stay home and get healthy.
Luis is the man, because he's Elmo's plan. The man, because he's Elmo's plan.
To learn more about preventing flu, visit flu.gov.
Welcome back to Bed. I'm your host, Cynthia Thompson. I'm here with two young ladies, and they're educating us about what to do when you go visit the doctor and what your rights are. Now, before we went on break, I said we're going to talk about patient rights. What exactly does that even mean? Do we really have rights as patients?
Well, years ago, there were a patient bill of rights created. I'm talking about decades ago. And when you walk down any hospital floor, there was a poster, a framed poster, a patient bill of rights. And that has, over the past decade or so, has changed to a patient care partnership kind of agreement. But basically, a patient has certain rights. They have the right to be treated with dignity. They have the right to be informed about what's going on. They have the right not to be treated as a research subject without permission. They have the right to confidentiality. You're all familiar with HIPAA, those laws that created havoc in the hospital system, but very important for confidentiality. They have the right not to be restrained. When I was a young nurse, we were able to restrain patients just using our nursing judgment. To protect the patient or protect the staff, and now you have to have a doctor's order to restrain a patient. So those are some of the rights that you have as a patient. You have the right to know what the treatment plan is. You have the right to participate in that. You have the right, a lot of people don't realize that you have the right to refuse treatment. And, but I'm in the middle of a thought here. You can refuse treatment, but you have to realize that when you refuse treatment that there could be consequences.
Yes.
Because if you continuously refuse treatment, then your insurance company may not pay for the hospitalization. And they may discharge you early because if you're refusing treatment,
why be there?
Why spend the money? And also, if it's an isolated incident, it's important if you're refusing something to explain to your doctor why you're having a problem with that. But people don't know that they can refuse treatment.
I did not know that either.
Right.
You were about to say something?
Yeah, I was, and that is that a very important right that I think that patients don't really realize is they have the right to understand and know everything. And if you're not understanding the big words that your doctor or your nurse is using, then you have the right to ask them to explain it. And in these days with computers in almost every room, in every hospital in the United States, they can pull up a picture and show you. So it's really our responsibility as patients to ask the questions that say, you know, I don't get this. And what's happening? And what are you expecting to happen? And what do you think this is going to look like in 3 months or 6 months? You have the right, but most medical people kind of assume, unless you ask and make it clear, that you understand what they're saying. So frequently you have to say, slow down, I'm not getting it. And it's okay. It's okay.
Or how do you spell that?
Or
you're using medical language that I don't understand. Can you talk in language that I can understand? And that's why, you know, we talk about having a patient advocate. And an advocate, again, is somebody who's at your bedside with you, who will intervene for you and support you and protect you when you, for the reasons that we talked about before, being confused, medicated, in surgery, anxious and pain on medications, that you can't speak for yourself.
I truly believe that after my son's sickness, when I look back on it, that he got better care because I was there asking questions. And I never had anybody say, in 25 years, I never had anybody say they wouldn't explain it to me or not take the time to explain it to me. But I think that because I wanted to know, and that because I was interested, and because I wanted to understand, and because every time somebody came into the room, whether it was at a doctor's office or a hospital, I made it clear. And then when he could, I made it clear to him. And I would turn to him and I would say, okay, do you understand that? Is it clear? Do you know, are you okay with this? Because as the patient, when he could, he had the right to know and understand.
You know,
I wanted to get back to patient rights because along with patient rights, when you assume the role of patient, you also have certain responsibilities.
That's true too.
And this is in line with what Randy was just saying. So the responsibility to ask questions, seek information, and of course in a nice way, because if you're nasty, you have a chip on your shoulder, or you don't know how to speak nicely, and you don't know how to say please and thank you, you're not going to get a whole lot in return, because that's just human interpersonal relationship theory. You know, if a dog feels defensive, right away the tail goes up, the ears perk up, and people attack. So that's part of your responsibility as a patient, is communicating in a nice way, and also being compliant with what the medical plan is, and letting people know when your symptoms change, and taking your medication, and following your diet, and showing up for your visits. So it's not just what the hospital system gives you as rights, but what do you give in return as a responsibility once you assume that role.
One of my favorite things that I frequently hear people is they'll say, "Oh, I was in the ER for 10 hours."
Yes, they do take a long time there.
And the truth of the matter is, we as patients need to be sympathetic and understand that tests take a long time, and that is their job. You cannot walk in to an ER and get out as quickly as you would to a doctor's office. And so, you know, we don't know, the doctor doesn't usually know how long it's going to take for tests to go through, blood or whatever, because they don't know what else is going on in the hospital and what the backup is. So when you go into the ER, patience. It's not necessarily bad care if it takes longer.
It could take 10 hours just to be seen,
Yeah.
depending on how busy the emergency room is.
Yeah.
And because there's a triage nurse, and she'll triage the patients as they come in. So anybody who comes in with a life-threatening condition, bleeding, gunshot wound, stab wound, a heart attack, a stroke, blood clot to the brain or blood clot to the lung, you know, those patients will come in and be taken right away. And then there's a patient saying, I've been sitting here for 10 hours, what about me? I'm sorry, you know, your thing isn't life-threatening. And CMC has billboards, and I don't mean to keep plugging CMC, I meant the healthcare system. They have billboards all over town where you can actually call their different hospital ERs and see what the waiting time is, so you know where to go.
I didn't know that.
Yes.
Yeah.
You know, lady, let's take a short break. And when we come back, I really want us to talk about medication.
Okay.
And the importance of taking it correctly, storing it correctly, and all those things. Okay?
Okay.
Okay.
Bring this one.
Cook foods to the right temperature using a food thermometer. 3,000 Americans will die from food poisoning this year. Check your steps at foodsafety.gov.
Hi, welcome back to Betty. I'm your host, Cynthia Thompson, here with some very smart young ladies, and they're educating us on our rights as patients. You know, one of the things you mentioned early on in the show, you talked about medications, and I want us to come around back to that because there seems to be a pill for everything.
Right.
That's wrong. When I go to the doctor, I say, can you give me a shot? I'm not going to remember to take the pills twice a day. But I normally don't get the shot. I have to remember to take the pills. So with the medication, how should we store it? Should we put it in the refrigerator, put it in the kitchen cabinet, carry it in our pocketbook? What's the proper way to store medication?
I would say that answer should come from your pharmacist. Because the truth of the matter is, with each medication, it's different. And so it would be inappropriate for us to say, do this or do that. And if you have to set an alarm on your watch or whatever to remember to take it, that's fine. But
That's another whole
but
issue.
there's
another
whole issue.
Taking
Taking
it,
it
yeah,
is taking-
and then
but-
taking it safely are two different things.
Right. So the other thing that we recommend is that you have all of your prescriptions at the same pharmacy. So that if there is an inappropriate interaction, bells and whistles go off, and then you're advised of it in advance. And with each prescription that you get a piece of paper that gives you information about the prescription, and I always advise that you read it. I can tell you a story with my son. At one point, he was given a prescription that said, do not take if you've had a stroke, and he had had 3. So, you know, your first line of defense is your doctor, and then your pharmacist, and then yourself. And you should take advantage of all of that, and keep track and know what you're doing. And so that's what I would recommend, is that you stay with one pharmacy.
Yeah. As far as storage goes, usually on the container, it'll tell you how to store it and what temperature. We had a situation where I work with an EpiPen, which is given for allergic reactions, and it said it should be stored, basically in air conditioning, and they had it outside with the kid all day in 90-degree weather. So, we had to have a conversation about that. So usually right on the container, it will tell you how to store it. In terms of when to take it, there are certain medications that are better taken at night, and certain in the morning. But we don't have enough time to really go into that. But the best thing to do is read the literature, like Randy said. Whenever you pick up a drug at a pharmacy, they ask if you want to be counseled on the drug. They give you a handout. Just the other day, my husband had some new symptoms, and he was on a new medication, and I pulled out the handout, and I said, well, it says right here, these are the side effects. So we called the doctor, and they took him off the medication. So again, it's all about being an informed consumer, like anything else. But like Randy said, there's a term called polypharmacy, where people are taking lots of drugs these days, like you said. And if you go to 5 different doctors, very often, if you're not giving them a good medical of the drugs you're on a history, they don't know what you're on. So it's important to bring all your medications written down, or the containers in a bag. But the best way to prevent drug interactions and having problems with the drugs is, like Randy said, to use one pharmacy. And a lot of people will shop. They'll go to Costco because this is cheaper, and they'll go to Walmart because that's cheaper. But then that pharmacist doesn't know what you're taking from Costco. And the new software that the pharmacists use, if there's a drug that you're prescribed that is contraindicated with a drug you're on, there's an alarm that goes off, and they'll be the first one to know. So it's really important. And even if you're on a lot of medications, you should never take an over-the-counter or supplement without calling your doctor and
that was my
making
next
sure.
question.
Or the pharmacist, where you're shopping, where your drugs.
I think
you
we
get your
used to
drugs
think
from.
that supplements were not powerful and they didn't really have the same interaction problems. But some of the the supplements are very powerful and can have extreme reactions with medication. So you need to be very careful about advising your pharmacy and your physician as to everything that you're taking.
I know that we've talked about quite a few things here, but if you all could sum up just some quick points for our viewers, what are some things that you would like them to take away from our conversation tonight?
What I'd like for them to take away is that you have a voice and that it's very important that you use it in the medical industry, that you can be a positive team member of your healthcare team and you can add a great deal. And if you do so, you'll probably get better care.
And probably have a better outcome. And also to realize that in any situation where you're ill or you have chronic illness, you should have an advocate with you. Somebody who's willing to support you and speak up for you if you can't speak up for yourself.
I want to thank you ladies for joining me again, but before I close, can you give me your website one more time?
It's patientaction.com. And it's free. And
there's all kinds of interesting information.
there's prayers. If you're looking for a special prayer to share with a sick one. I visited a friend the other day and I said a prayer with her and she was crying. There's inspirational sayings. There's an online health history form that you can print up and forward and email. There are advocacy articles. There's a daily news feed of all the health, if you're a health news bug, all the current health information. So it's a world of information and it's totally free, and we invite everybody to become part of our Patient Action family.
Okay. And I want to thank each and every one of you for watching my show, Better You, here on Public Access 21, every Wednesday night at 6 p.m. Thank you so much, ladies.